Parkinson's disease and long-term healthcare claims. This is part 4 of our multi-part series in which I'm going to be talking about long-term healthcare benefits and what happens in a Parkinson's disease claim. Now, I'm going to be talking in this episode about what you have to do to win a long-term healthcare claim and how I can potentially help. I will tell you right off the bat that a diagnosis of PD is not sufficient. Just because there's this diagnosis doesn't mean entitlement to benefits. You've got to tie the medical evidence that documents the inability to do the applicable covered activities of daily living to the need for your claim. In other words, we've got to establish that the terms of the policy, these are the activities of daily living that are impacted. Here is the diagnosis, here are the symptoms, here are the medical records, this is the care plan, this is why you can't do these activities of daily living because of the PD. And in terms of the care, not only is this the nature of the care that you need, this is the facility that you need and the kind of providers that you need. You can see putting this all together requires teamwork, and I think you should be consulting with an experienced attorney such as myself right from the very beginning. What I would be doing is reviewing the policy and terms, explaining what benefits are covered, what needs to be done to obtain those benefits, what proof is required, how to deal with delay and denial. And that involves strategy, because even if you or your loved one is entitled to care because of PD, you shouldn't be making any huge financial mistakes by not having your ducks in a row with the adequate proof, putting you or your loved one in a facility or hiring people that aren't covered by the policy or the plan. There are all sorts of big mistakes that you can make. You need to understand, for example, is there an elimination period that you won't get paid any benefits? You need to understand what those benefits are, how long they will be paid, are there caps on benefits? You just need to understand all of this before you make a huge mistake. You can give me a call at 727-894-3188 and we can discuss this. And particularly if the claim is being delayed, or the benefits are being denied or terminated, it's time to call me, 727-894-3188. I hope you've enjoyed this multi-part series on the entitlement and rights to benefits for long-term health care with PD. If you have any questions, call me today, 727-894-3188.